and evidence and level of evidence. So I think there's there's progress made, that they are also, in a way, agenda setting, not only, but together with scientists to develop these recommendations. And within EULAR, just as an example, they have now also developed recommendations how patients' representatives should be involved in scientific projects. And of course the result is that there are more patient-centered guidelines. And then the third, thinking about health strategies. I think Neil Betteridge this morning introduced you to all the activities that on a European level has been done by patients. And I think, just to be very short, that a number of projects like the EU MuskNet project, what was presented by Til Ulich, that project was also initiated originally by the patients, and it was taken forward by Tony, who wrote the application to the EU, but also in approaching the EU institutions. It was the patients who started that process. So we hope that will lead also to more patient-centered health strategies. And then last, I talked about the education of health professionals, and also here we see that patients are involved in education of professionals. There is a very successful program, what is called Patient Partner Program, where people with arthritis educate students to do the examination of joints. And by doing that, they also tell a little bit what it is like to live with a condition like rheumatoid arthritis or ankylosing spondylitis, because they are now also partner in this project. And another, also osteoarthritis patients now in a large project that is started by the Swedish League some years ago, is the osteoarthritis communicators, where also patients with osteoarthritis educate health professionals in what it is to live with a condition like that. So more patient-centered health professionals. But again, of course, the question is, by doing this, and I think, and that's a strong belief what I have, looking at the first terms that I showed you, what we should mean with patient-centered care, holistic view, dialogue, and things like that, that are beautiful words. But to put it in practice, I think the best way to develop patient-centered care is just by working together in your projects with patients. And that's not easy, because certainly in the beginning, maybe it might cost time to do. But on the long run, you will find out that services will be more targeted, will more really go answer the needs of the patients. So how should you develop these kind of services? My suggestion and recommendation would also be, well, just involve on an active, equal basis patients from your clinic, for instance. So there are some challenges still, and I don't think I should go through all 10 of them. I thought I had to come with the top 10. These are the challenges for the coming 10 years. But just one that I would like to pick out here, number 2, patient-initiated consultation. It answers a little bit about what Peter Brooks this afternoon introduced with this iPhone thing, electronic consults. Even at my own hospital, if I leave my doctor, I get an appointment for over 3 months, for years already. But it's not sure that I have a question within 3 months. And if I've just been there, you will always see 2 weeks later there is something that comes up, and then that's the moment that you want to visit your physician. So then you have to phone, and you feel a little bit reluctant because you don't want to. You know how busy he is. And I know that there are experiments with open access consultations. And clinicians are often very afraid that all their patients will phone tomorrow for a consultation. But the fact is that they don't. They become more aware and responsible. Do I really need this consultation now? So they don't start calling for consultations. But the impact is, and that's the information that I get from doctors who are doing this, is that they see patients at the right time. And that's also what I want. I want to see my clinician at the moment that I have questions, or whether when it's going worse, or I want to change something. And then I wanted him also to have some more time for me. And I think thinking about this, that would also be a challenge, if thinking about more patient-centered care, that it's really delivering care initiated by the patients and not according to the structure of the physicians. And there are other issues, but I don't think that I should go to that. My conclusion is that genuine and active patient involvement is key for improving healthcare services and for developing patient-centered services. Thank you.